Hello, we're live now. Hi, everybody. Thank you so much for joining. Welcome. I see the numbers slowly coming up, and so I see that we're slowly going to have people joining us over the next few minutes. But for the time being, I would love for all of you guys to type in the chat, get familiar with the platform if you haven't already. I know some of you have been coming to a few of the events so far, which were previously on YouTube Live. And so now we're on a new platform. And so if you enjoy this platform, give it a little clap. If you guys see the clap icon towards the bottom, just so I can get that feedback and make sure that you guys are enjoying this platform. I'm seeing lots of claps, so that's good news. So for any of you who haven't been to any of these events before, quickly, I just want to introduce myself. My name is Nadia Hassan, and I'm the founder and CEO of Zaya, which is an education platform with the mission to educate individuals on integrative and mind-body approaches to support their mental health and their physical well-being. And so two of the ways that I'm doing this is by running these monthly events and also workshops as well that help to educate individuals as well as healthcare professionals on these different modalities and really allowing these experts to share their wisdom and their expertise so that they come from a really highly credible source. And so I love putting these events together because it's really an opportunity for not just education, but also just community and collaboration. So as I said, please just type in the chat, let us know where you're from and maybe also what your intention is. And really, I want you guys to use this as an opportunity to meet and connect with like-minded people. So I know we're in a really, really strange times right now, but the internet has been a really great tool for us to connect with other people. And I love this platform because it kind of gives us more of an interactive experience. And so, and because of the title of today's event, which is Transforming Chronic Illness with Mind-Body Medicine, for those of you who have joined and have a chronic illness, I understand how important it is to be able to connect with people who might be sharing the same diagnosis and who really understands what you're going through. So like I said, feel free to meet and connect with other people. And also we'll try and have time for at least a 5 or 10 minute Q&A towards the end. And so if you have any questions while Matt and I are talking, you can put those questions in the chat. Or another really cool option is in this platform, there's the ability to do something called, I think it's called pass the mic. And basically I can hand the mic over to anyone who's in the audience and you can ask a question, show your beautiful face so you can hear your voice. And that way you can ask the question and it's just a really cool experience. And finally, this event will be recorded. So if for any reason you have to jump out, just know that the recording will be sent to you next week so you can replay it. And I'll put the timestamps in there as well in case you just want to hit the important notes. And then one last final reminder before we jump in and I introduce Matt to all of you. On January 20th, we'll be having our first workshop with Zaya for the year 2021. And the workshop is titled, You Are Not Your Mental Illness. And so this is a holistic mental health workshop who will be led by mental health advisor Andrea Escobar. And Andrea has a really incredible background. Andrea has conquered depression, mania, psychosis after being diagnosed with bipolar disorder type 1. And her health really started to get impacted from a lot of the medications that she was taking. But she was able to pull herself out of it using mind-body medicine, using these different holistic approaches. And she would love to share these tools and these resources that helped for her. So if you're interested in signing up for that, you can click on the link at the top of the chat that says sign up. Okay, I'm done talking. Now that we have a few more people in, I would love to introduce today's guest. So I have with me Matt Erb. Matt Erb is a physiotherapist who extensively works with individuals who are experiencing acute and chronic health conditions using an integrative holistic model of care. Matt's a senior faculty member and clinical supervisor and a clinical lead for the Center for Mind-Body Medicine. And he's also a clinical physiotherapist practice with Simon's Physical Therapy in Tucson, Arizona, that focuses on mind-body integrated care. Matt's also the founder of Embody Your Mind, and he's also an instructor for Andrew Weil Center for Integrative Medicine, and he regularly teaches for the University of Arizona physician training programs. So I'm really excited to have Matt here with me in this event. As I mentioned to him previously, I can really feel and see the passion behind the work that he does, and I'm just excited to share all of that with you. So, Matt, I would love for you to introduce yourself and maybe just get started with how you got started in all of this and why this is so important to you.
Okay, well, thank you, Nadia, and hello and welcome to everyone that's on and those that are watching this later. As noted, I'm Matt Erb, and I'm a physiotherapist by training. I'm in Tucson, Arizona. I'm originally from Iowa. I grew up in the Midwest, spent many years, 16 to be exact, in Minneapolis, Minnesota before the move here to Arizona. I was happy to trade climates for those that know anything about Minnesota weather. And appreciate everything you're doing, Nadia, to spread the word about evidence-based integrative and healthcare practices, in particular mind-body integration. Seeing more and more of this happening, and for someone who's been doing it for much of their career, it's exciting to be in a time where there's not just more exposure, but there's more acceptance, there's more validity, there's more scientific evidence that this isn't really, for me, alternative. It's fundamental. It's fundamental to human experience, and my approach is to take what can sometimes be very complex science and try to reduce it to essence, to messages that are clear and accessible and relatable, sort of on the other side of all that complexity of the science and the headiness of it, and try to offer it not just to patients, but also to professionals who are, have some sense of the need to move into a more whole person form of support, but not quite sure how to do it, not quite sure what language to use. So that's kind of where my passion lies, is making that integration more accessible and expanding it as part of the ongoing transformation of healthcare. Sometimes we tend to think that it's either the biomedical model or it's this integrative, or you can throw around all these terms, complementary and integrative health, or CAM, and for me, I think that non-duality, which is this both and, I don't really see them as necessarily either or. I think it's taking the best of both worlds and merging them into a better form of healthcare that allows people to make their own choices about which paths and which routes they want to use to address their health challenge, their experience, their illness, their injury. So I know I threw a lot out, but that's kind of the gist of it. I did ask about how I got into this, and I do like telling the story that right out of school, and this is in regards to pain, but I remember in my first job, I was in a little clinic in Hopkins, Minnesota, and my desk mate, who's still a good friend, her name is Molly Lon, and she subsequently went on to get a PhD in mind-body medicine and works for the Veterans Administration in their chronic pain programs in Minneapolis. But we sat together and we were always talking about mind-body stuff, partly because of our shared interest in yoga. And I remember one day I walked into a treatment room and I went, "Oh my gosh, you must be in a lot of pain," which of course wasn't a very nice introduction of a way of responding as I walked in the room in hindsight. But the person looked at me and said, "Well, I don't have any pain." And looking back, this individual had some of the most severe physical deformities from kyphosis, scoliosis, rheumatoid arthritis that I had ever seen. And I'd even had the chance in the medical clinic to see some imaging that had been done recently for this person for some GI stuff. And they'd taken these CT scans of the abdominal region, but it happened to include images of the thoracic and lumbar spine. And there were multiple compression fractures in the bodies of the vertebra in the thoracic and lumbar region. And here this person is saying to me, I don't have any pain. I said, well, what are you here for? And she says, well, I've been falling down and I want to work on my balance. And I remember something inside of me going, oh, there goes everything I know about pain.
Yeah.
Because I would have thought that this person would be in a lot of pain. And that really began my thinking about how much more is actually involved in the emergence of pain, the pain experience. Now 20 plus, 21 years later, I've landed where I'm at now, and I don't have the answers figured out, but I've certainly devoted to understanding it as best I'm capable of at any given moment, and then offering the best possible ways to support people who are experiencing challenges like that.
So maybe to give a little bit of a context for some of the people who are listening, what are, just to start off, what are some of the conditions that you have been or work with quite frequently in the context of mind-body medicine and just the work that you do?
Yeah, probably top on the list would be all craniofacial related disorders. So migraines, headaches, TMJ, trigeminal neuralgia, occipital neuralgia, craniofacial sort of problems. I was recruited into a headache specialty clinic, which was multidisciplinary. There was neurology, PT, OT, and psychology that team worked with individuals to support their experience of chronic headaches. And so I spent a lot of years really getting to know that. But I would say really, and that also includes vestibular disorders, dizziness, vertigo, lots of cranial nerve disorders, cranial nerve palsies, specialty referrals from ear, nose, and throat doctor for people with voice cough issues that weren't addressed using the traditional models of care. But that's expanded to the whole of chronic pain. And right now, my practice is predominantly working with mental health, which is less common in the US than it is in some European countries where the physiotherapy within psychiatry and mental health is more established across certain European countries than it is in the US. But I hope to continue to advance that here, and that is my practice, working with a number of psychiatrists and other mental health professionals who refer people in for mind-body integrated care. They're experiencing PTSD or depression or anxiety or bipolar, and they have headaches, and they have chronic pain, or they have fatigue, insomnia, functional digestive disorders. And it's helping them connect dots and piece together so that their care isn't so split between the physical care and the mental health care, which is, of course, one of our big challenges. We've been undoing hundreds of years of that type of splitting.
I see. Okay. Wow. Okay. One second. I'm starting to see a few people say in the chat that they can't hear something. Some people can. If you're having any issues, try to exit out and come back in, or just refresh the page and let me know if that works. If not, I'm not sure what else we can try and do, but try and give that a go and let me know how that works out. So I want to get into really the meat of all of this. There's so many things that I want to cover, but the first thing I really want to cover is what exactly is mind-body medicine. So like you said before, there's so many terms. Like you said, complementary, alternative, like integrative, there's a million terms. But what specifically is mind-body medicine? And how does it view the relationship between the mind and the body?
Right. In my work with the Center for Mind-Body Medicine, what is kind of a classic or standard definition is mind-body medicine as a whole, as an umbrella, focuses on complex interactions among or between our concepts, our sense of mind, brain, body, behavior, and the ways in which the levels of human experience, emotional, mental, social, spiritual, behavioral, interact and affect health or the emergence of health or illness, if we look at that as bidirectional.
Okay. And something that I'm really fascinated by is the biopsychosocial model. And I know some use the term, I've seen you use the term biopsychosocial spiritual model, which really covers the interactions between both the biological and the physiological components of illness. Can you explain what that is and also why you added the spiritual component to it as well?
Mm-hmm. The biopsychosocial model dates back to the 70s by George Engel, and he proposed that model as sort of an alternative or an evolution of the existing or prevailing biomedical paradigm to not just focus on what was perceived to be biological factors in health, but how psychological and social factors informed that. Challenge with it is that unto itself, without foundational shifts in the base of how we perceive healthcare, that idea often gets compartmentalized into three different things, and the way that clinicians try to actually support people at that level is often still separate topics, like it's throwing in something, but the base model hasn't really changed. And the spiritual piece is in the recognition of that which people at an individual level believe, their individual beliefs about purpose and meaning to life and existence. Sometimes that's religious for people, sometimes it's not, but it's helping people with that level. And so naming that, my exposure to that comes from my work and involvement with my colleagues in yoga therapy, where, yoga in its whole form, and not just the physical form, the asana form, is a series of limbs, different facets. And one of my mentors, Matthew Taylor, describes it as a psycho-spiritual technology, that yoga is a psycho-spiritual technology of sorts. And so a lot of my colleagues started adding in the word spiritual to say this is more complete.
Yeah.
Now, in an effort that'll be coming out this spring, I tried, and along with some others, to suggest that the word integral or integrative can be a single word that encompasses the entirety of all of that.
Yeah.
Not to imply specialness, because my hope is that the label eventually wouldn't be needed if the care models are able to continue to evolve, adapt, and transform towards a more holistic or whole lens. So that's kind of where I see it moving, is using that word, and then not wanting to apply better than or specialness or let it bolster a person's ego. Oh, I'm an integrative. I think it's used to acknowledge to people, I want to help address the whole of your experience and not just overly reduce. Eventually that might actually fall away as we combine biopsychosocial spiritual all together into a more foundational approach.
Yeah. So would you say, if you were to categorize the biopsychosocial model into one of these terms, would it be integrative medicine? Or would it be Embodied?
Integrative, yeah.
Yeah.
We actually explore all the derivatives of integrated, integrative, integral, and they all derive from the root word of integral, which implies that the sum of parts is the whole. So it's taking that lens. And with biopsychosocial alone, we can look at the idea, and this is often a challenge to our thinking processes, but I don't separate out psychological from biological.
Yeah.
I use the term psychophysiology, and I'm very careful about the words I use because I'm wanting to not imply or reinforce inadvertently what's already deeply embedded, implicit in our unconscious, that the mind is somehow separate from what's happening in the physical body.
Mm.
We've split aside the psychosocial realities of our life from what's manifest in the body. And we can talk a little bit, perhaps we'll get to this, about why that might be in the challenges of that. But that psychology itself is embedded in physiological correlates. You know, there's a neurology to it. There's a chemistry to it. There's a physiology to our psychological experiences.
Oh, yes. Yes.
And the same would be true for the environment. So your social environment, your physical environment carries biological implications, direct physiological, biological impact. There's one study that was done in, I don't remember the reference, but I remember reading about it. And I think it was somewhere in Southern California where they took people with major depressive disorder and they literally relocated them into new living environment, socioeconomic and living environment. They provided them a different, and a large percentage of them, the depression resolved and stayed resolved as long as the support was sustained for the new living environment. We tend to treat depression as somehow an individual moral failing or a weakness, or it's solely an individual thing. But when we think about that, oh my gosh, what if the environment or the environments that we're living and working in are the major determinant? It then helps remove some of the sense of blame or shame or causality to the experience. That doesn't mean I may not have some personal work to do or some personal responsibility to cultivate, but it reminds us that, you know, that we're not solely, it helps to undermine the blame, shame that can come, the stigma that can come about when people are experiencing different conditions, to think, oh my gosh, there's so much more here that's influencing my health, and I'm not just solely responsible for it.
Yeah. In speaking to the biopsychosocial model, do you believe that that each have an equally weighted importance on the person? So do you think that maybe one is more important than the other, or do you think that they're all equally important and that all of them should be addressed in order to have this sort of whole person care approach?
I think this is where individualism actually is a good thing. Individuality rules. It's so unique to each person. What that recipe, that soup of ingredients that contributed to the emergence of the health issue or challenge or problem actually is. It can be as simple as, I have a piece of glass in my foot, let's remove it. Oh, that feels much better. And there is a role in some cases for the fix-it sort of tendency that we always hope for, that there's a quick, easy fix. Something can be done for me or to me that removes this pain or this challenge. The vast majority of health manifestations are far more complex than that. And so it's, in one case, it might be largely that the person's personal lifestyle medicine is optimal, and they still have major health challenges. So they have everything in place, and it is the environment. So is there a way to support people in the environment? And if we can't, how can I support people's relationship to the fact that this is my present experience?
Yeah.
For others, it might be more nutritional. Some people need to do a greater amount of individual psychological work. With my own health history, with having chronic headaches and migraines myself, I have no doubt that my early life experiences of trauma, high stress exposure in developmental times, was a key informant in that. And I'm a huge personal advocate. I'm at a point in my life where I don't really experience any sense of significant shame around. I value psychotherapy. I like to continue to do the processing out of my personal unconscious, my life experience, towards resolution, towards healing, towards transformation. And I do think for some people that might be a greater emphasis. But it's for me to decide. It's for me to be a guide to help each person decide, where do you think the most emphasis is needed?
Mm-hmm.
There's a significant mismatch, because we do get a lot, as a physical therapist, we get a lot of individuals who want, naturally, it's not a weakness, we want that physical fix. We want a manipulation or a massage or a myofascial release that will somehow take it away. And so sometimes there's a mismatch between what I want, and what is actually needed. We need to shift that emphasis and weight it more towards psychosocial factors.
Mm-hmm.
And that's has to be a collaborative process explored between two people in relationship. And that's where the healthcare relationship comes in. That foundation of the relational space is so important to even be able to begin to do that.
Yeah. What I would like to hear your thoughts on how conventional medicine approaches chronic illness and the difference between conventional medicine and mind-body medicine, and how one can support the other and the other can support, how they can basically support in different ways. Like, what are your thoughts on that?
I think that the biomedical model is most effective for acute injury, acute trauma,
Mm-hmm.
than it is for chronic health issues. And I think that the attempt, I see the biomedical model as being more weighted towards reduction of causality. It's
Mm-hmm.
trying to identify a label for causality. So that when you look at the extent of testing that's done, and also rooted in this fix-it paradigm, that if something's broken, let's fix it. And then we look at the fixes that are thrown at what's broken, and they also are deployed in a way that is reduced from the reality of causality. There's a paper out. His name is Low, L-O-W, and it's a dispositional theory of causation. And it's that there are dispositions in place. There are ingredients that we each carry that may be priming or predisposing. And so you get this recipe in this mix. Mm-hmm. I think biomedical tends to try to, it's like back pain is a good example. I have someone right now who is getting interventional pain management, frequent injections, tissue injections. And that supposes that the problem is solely localized in the area that we're injected. But when you really think of the living system and the complexity that might have informed that setup, we've missed the vastness that might have informed it, and we're just we're reinforcing the idea something's wrong right there, and that's the only thing that's wrong. So let's keep injecting it. And that doesn't make sense to me when I look at it from the lens of complexity. Mm-hmm. So I think that is a key distinction. I don't want to suggest that reduction is bad, because sometimes we do work down a level. Like, I see integrative thinking as maybe we do need to step down a level and work more at the physical level on this particular situation. And sometimes we need to go up into a greater level of complexity to look at the psychosocial or even spiritual factors, if that's within the person's realm of a belief that there are other determinants to the manifestation of their health that could be explored.
How can people really get to understand what those determinants are? I think of the root cause of disease. This is something that frequently crosses my mind, and I'm constantly trying to get to the root cause of my own illness. So I have endometriosis, and that's something that I've always viewed as really coming from a place of trauma, suppressed emotions and just basically a buildup, as well as a few other things that have happened, like just biologically in the body. But basically, I've realized that there's so many different components that have contributed to my condition. But it really took time for me to really try and understand that. And even now, it's just like, how am I supposed to really know that part of my condition was manifested because of some sort of trauma that happened in my life? How can people really get to understanding where their disease came from? And then I have a question after that.
Yeah. Well, your experience, I think, presents a good example that we do know that adverse childhood experiences, for example, the ACEs research as a whole, mm-hmm. is associated with marked increased risk for a wide range of health challenges across the lifetime. And that can include trauma. I believe trauma at any age can set in motion. We can come back to what the research says, that toxic stress, high or sustained or unmitigated allostatic load, that's the buildup of stress across time, is something that is associated with chronic illness and disease. So at the foundation, how are the biological systems regulating themselves? This is the autonomic nervous system, the chronic, pervasive, high level of activation or dysregulation. I shouldn't say it's always high level, but it's not an optimum level of management of demand and arousal versus rest, that balance. Mm-hmm. We know that that's a factor. We know that chronic disease can develop due to both genetics, but epigenetics. So we do all have a genome that may predispose us to certain conditions, but then as that interacts with the environment, our experience, our social environment, our physical environment, that's like turning genes on and off. We also know from the ACEs research that when we've had stressful or traumatic experiences earlier in life, it does influence naturally. This is totally normal how we cope. So the adoption of adaptive coping tendencies, such as the foods that I eat or what I eat or how much I eat, substance use, isolation, introversion, avoidance of social interactions. So there's different pathways. There's the stress pathway, neuroendocrine, hypothalamic, pituitary, adrenal, all this sort of mind-body science. You have the epigenetic influences from experience, and that can go the other way. We know that there are positive childhood experiences that can counteract the potentially adverse effects of stress and adversity and trauma in childhood and go in the exact opposite direction. So epigenetics can work in either direction. Mm-hmm. And then we have the maladaptive coping route. Now, what I want to say about this is that we do have the risk of, and I see this happening a lot, trauma-informed care is extremely important, but we do actually run the risk of over-assigning the causality of our own health experience just to trauma. Yeah. And then we also miss the integrative lens of all the other variables that might be in the recipe.
Oh, it's so true.
Yeah.
Yeah.
So I'm not sure if I got off topic. I think I might have, but
no, keep going. I'm soaking it all up. So I guess it's like, so at that point, where do you start? I mean, because there's these different factors that can come into play. It's like, well, then where do you start when you're wanting to enter into a state of healing, of transformation? Do you have to start with the psychological factors, so addressing like your psychological needs, or is it the physiological that you address first? And how do you know if the root cause could be either trauma or it could be something biologically? How do you know which one you need to do first? Do you do both? Like, what is that? Like, how is somebody supposed to determine that? Like, what sort of treatment protocol they should start?
Mm-hmm. Yeah. So I see someone just, Dana Lee posted, address together holistic. Well, that I think is my approach, that I begin to address all of it simultaneously by focusing on the whole of the person. I want to establish a relationship that allows me to be attuned and form a sense of what is this person's experience like? And what do you believe are potential contributing factors? How are you making sense out of this experience? And then I would listen deeply to what those answers are to begin to get a sense of. So I always start with where that individual sense is coming from. The other thing that I do pretty uniformly, because I do believe that at the biological substrate, dysregulation. We talk a lot in mind-body medicine about the autonomic nervous system, which is healthy on both sides, sympathetic gas pedal, parasympathetic brake pedal. It regulates our physiological response to demand and returns us back to homeostasis when demand has passed. And it's an endless combinations of activation. I tend to begin to cue in at the physiological level to those foundations. So, for example, there's a lot of research on heart rate variability as a biomarker. We can do simple recordings of people's heart rate variability to begin to get a little bit of a window into the physiological resilience of this autonomic regulatory system, the efficiency of it. And so I do a lot of work with foundational mind-body skills that have been shown to improve those biological underpinnings that help to mitigate stress, the stress response that help to improve our ability to actively contribute to the self-regulation of our stress experience. So I do a lot of that, and I don't separate that out, from psychological factors, but the extent to which individual psychological content kind of comes in, that's through permission. I often say, even when I'm exploring history, I say, I just want to get a little glimpse of what you have experienced, what your nervous system has been through. And I'm not making any assumptions as to the relevance of any of this at this point in time. It just gives me a little bit of a sense. And I say, and I want to approach this from let's look back but not stare. I'm not here to do analysis of this content, and I'm not here to make assumptions about whether it's relevant or not. But I want to get a feel, because we do know from the research that, for example, exposure to adversity in childhood may be a predisposing factor. And that doesn't mean we're going to spend our time doing a regressive analysis of your childhood. Just want to get a sense for, how much stress informed the development of your nervous system. So you can kind of hear a bit of a tone in how I do that, because it's vital that I see the biological underpinnings of safety, nurturance, and empowerment. And I do believe that there's biological correlates to these ideas of safety, nurturance, and empowerment. That the way that I work is attuned to am I working with this person and with myself simultaneously in a way that carries potential to support those underpinnings. So again, I think I'm getting a little off from the question, but yeah.
So something that I want to speak to is chronic pain specifically. So one question that I wanted to ask you is pain a sensation or a perception? What is the meaning behind chronic pain?
This is a real rabbit hole, and there are pages and pages and pages of threads on social media of people arguing and debating and discussing, and some contemplatively, some curiously, some with strongly reified beliefs. So it's a real rabbit hole. I really appreciate there's a gentleman in somewhere in Australia, John Quintner, and he and some colleagues wrote a paper, and they said pain is an aporia, and that means an irresolvable theory. I prefer the word Mysterianism as a philosophy. There's all these neuro philosophies, and Mysterianism is we don't really know. For me personally, pain is a physical experience. It's embodied. It's a sensation. I do believe that while focusing on it as a sensation, that each person's experience of sensation is highly unique, and we can use the word perception. Like each person will perceive bodily sensations in very unique and different ways. So for me, there's a both and, but I like to keep it focused on it's a somatic, embodied physical sensation. It's a sensory experience, and build from there, because some of the tendency in the brain-centric view of pain, it can lead people to think it is all in the head, including that say it's all in the brain. Some of the colleagues that I follow, they say, the brain is necessary but not sufficient for pain. So at the physical level, we need a brain to be able to experience pain, but it's not necessarily sufficient. I have seen podcasts where that question is the entire hour or 2 hours, discussion between people. And what I want to do is work with the person to try to best understand what their experience is to the best of my capability and support that experience. And that's where I bring in a lot of, it is a foundation, acceptance and commitment therapy. I know I'm changing topic a little bit, but I see that the 6 core messages, ACT, acceptance and commitment therapy, has defined 6 what might be considered core dynamics in human experience that may contribute to our suffering, to our experience of suffering. And examples are experiential avoidance. Oh, I can't have this experience. Make it go away, fix it. This is unwelcome. On the flip side of that, wisdom teachings say our tendency to say, oh, this feels good, more of this, please. Our attachment to the feel good is equally a problem. So I won't go through all of them, but you have the 6 core challenges that working with those can help improve, perhaps transform might be a better way, people's relationship to their individual experience of pain, whatever that is. Since I can't know what it is for that person, their relationship to the sensation of pain, I might say.
Okay. I want to, all of this is really, really interesting. I want to be able to check in on some of the things that people are saying in the chat. We have a lot of people just commenting and talking about their experiences and their diagnoses. I don't know if you're able to see this as well. I'm trying to find a question that someone was asking. Where is it? I guess the other question is, where is it? So, talking about pain, how should we be speaking about our pain? How should we be addressing our pain? There's an app that I've used that really talks about the more of the neuroscience behind how to address your pain and how you can basically change your language and use different sort of meditations to address managing your pain symptoms. How important and how useful is that, or how, what is really going on in the body when we're able to change the way that we speak about our condition? And is that really effective?
I I think it's important, this again, in terms of seeking solutions. If we approach the idea that cognitive behavioral shifts, so looking closely at what my mind is telling me about this pain, so I'm able to look at those thoughts and I'm able to change my relationship to the thoughts. So go, oh, isn't that, I always often say, let's just imagine we take that thought and throw it up on the ticker at the bottom of the television screen. Yeah. You go, oh, interesting. I wonder why the mind is formulating that thought. So it's appraisal. So this is more of a cognitive behavior. I think it's important. And I also think that if we were to infer to people that changing their relationship to their thoughts, an act, you don't change thought at all. You don't try to change the thought or create a new thought. You accept the thought and not get hooked or fused by it. Yeah. Cognitive behavioral therapy, some of the earlier versions of it, they would say, work with changing that thought or work with the formulation of positive thoughts or affirmations, sort of thing. But that can also, for some that works really well. For others, that becomes a reinforcement of the avoidance. Right? I'm avoiding the actual experience of distress, of discomfort, of emotion, of the thought. So I do think that working at the cognitive level is important, but it looks different for each person as to how that shapes up. Some use apps. I have a colleague who researches the use of apps for different health conditions. And so for some that might be very appealing. It might be very practical. Other people, I think, would really need to do the work within an attuned relationship. If it's accessible, if it's possible, to work with a process-oriented form of rehabilitation. It's not just, oh, you get 6 visits, but let's establish a relationship here and see and work on this over time. Yeah. Sort of thing. So I know I jumped around a little bit from the cognitive piece, but my point is not wanting to set up the idea that any one facet of this is going to be the cure-all. And none of it is a one and done either. Most of this is process oriented, which in mind-body medicine, we say it's slow but powerful medicine. It's potentially powerful, but it's often slow. So if I have realistic expectations out of the start, and I value the time that I spend practicing a mind-body skill, such as guided imagery or a meditation practice or yoga, independent of an attachment that this is going to fix and take the problem away, but I innately value the practice. I think that naming that and helping people understand that shift can set up a greater potential of cumulative benefit over time by staying with it and realizing this is a process. It's not just a destination that I'm going to arrive at. My pain or whatever my condition is going to suddenly be gone.
Yeah. Oh, that's so incredibly important. I think that I really want to speak to what are these different exercises that people can start using and integrating into their lives. But before we do that, I know we have 10 minutes left, and I really want to spend some time for a Q&A. So everyone, if you have a question, pop it into the chat. And then my laptop is actually about to die. It started with 100% and all of a sudden it's down. So I'm going to quickly grab that. And in the meantime, everyone ask your questions and I'll come back and we'll take a look at those.
Yeah. And while you're doing that, I'll just answer one thing here. I see someone asked about what are the other challenges that ACT defines, tendencies that we carry. If you like, there's a YouTube channel called Health Flicks, and that was launched from the yoga community in response to COVID to offer, this is back in March last year, March and April, to offer a series of talks to support people because a lot of people were transitioning to lots of time at home. And I gave a presentation on embodied acceptance and commitment therapy, and I paralleled the ACT model to yoga. to the yoga teachings. And so all 6 of them are defined there, along with very practical, experiential examples of how to work with those. So that's a good resource if you'd like to look into that further.
Okay. So, actually, one of the other questions that I really wanted to ask you is it possible to be able to reverse the effects of autoimmune diseases and other illnesses through mind-body medicine? So that's something we didn't really talk about, is like, what are these different modalities in mind-body medicine, and as well as tools and different perspectives that can be used? But first, addressing the first question is it possible to reverse some of these conditions that are considered chronic, terminal, etc.?
It is, but I do not know what the exact recipe is for any one person for that, the possibility of that, an actual reversal to emerge. And I think it's important to, if we have a chronic health condition, to try to approach it with realistic expectations. This doesn't mean I abandon expectations that there's the possibility of improvement or remission. We know that conditions can go into remission. The Institute of Noetic Sciences undertook a massive study back in the 90s, I think, and they have some 90 or 100,000 health records of people who had spontaneous remission of severe, often terminal conditions. And they interviewed as many of them as they could to find out what they had attributed their remission to. And oftentimes, interestingly enough, it was psychospiritual dynamics in their life. So that making space for the possibility of those realities, but also helping people have, I work very hard to not create false hope or exaggerated claims, to be very grounded in what is right now and how can I best relate to my condition right now. Having said that, and I see one of the people, Penny here, said, can this be used in neurological diseases such as MS? And you're asking about chronic autoimmune, severe autoimmune. There's a researcher at the University of Iowa. What is her name? Anyway, she had MS. She had pretty severe MS. She completely reversed her disease. She apparently no longer has signs of it. And she began researching the approaches. And a lot of it is epigenetic through dietary modification, along with other lifestyle factors, mind-body skills. I think that the approach needs to be fairly comprehensive so that people are addressing psychosocial and stress factors. They're addressing nutritional factors, support for healthy relationships, movement and exercise, integrating their personal spiritual practices. So I don't think it is any one factor, but I do, and I've seen cases. Dr. Howard Schubiner, who does a lot of research on emotional awareness and expression therapy and the Unlearn Your Pain program, he has had people who've report complete remission of chronic pain. But I've also known people who've gone through programs like that who didn't have any effect or who had partial effect. In the randomized controlled trials on it, they're showing statistically significant improvement. So it's definitely on to something, that it's possible for the reversal. But we have to be very careful that we're not suggesting that will happen for everyone, because there are hidden determinants to everyone's health, some of which may not be knowable. And so that's where we come back to ACT and my relationship to my health and living forward in the service of my values, despite the fact that I have this passenger of MS or chronic pain or whatever it is on my bus. I still have my GPS and I have my hands on the wheel and I know why I'm driving. That's one of the metaphors in ACT. So it's a long answer to the question, but
yeah. And I think that's what makes it so difficult, especially for allopathic doctors, to be able to know if it's safe enough to integrate these sort of practices in for their patients, because of, like you said, there's so many different determinants. When somebody can use something, might work for one person, but it might not work for another person, and the lack of evidence of that, it makes it very difficult for a lot of these conventional medicine practitioners to be able to confidently refer their patients to some of these different modalities and methods. How can doctors, how can these conventional practitioners start to guide their patients toward this? Like, how can they start to really integrate this into their practice when it comes to, a lack of evidence on some of these therapies?
Yeah, that is, well, let me start by saying in the US, I think that has come along a lot more and a lot further than some other places in the world. Integrative medicine is a board certifiable subspecialty now. They do work very hard to keep it academic oriented, evidence-based or evidence informed. Your question for me speaks into the larger, it's another rabbit hole that when we look at risk assessment and we really look at the data on many of the biomedical practices, ironically, that are supposedly evidence-based, we have to be able to challenge ourselves to look at the risk profile of what the biomedical intervention is. If the doctor's saying, I'm not sure if that's safe for you to go do this alternative or complementary or integrative approach, I have to really look at where does that come from? And is that true relative to what the biomedical proposed solution or offerings are? We know that there's all kinds of challenges with evidence, the quality of evidence, the transformation of evidence. In this book we have coming out, we put a heavily referenced but very short condensed view of evidence-based medicine, evidence-informed medicine. How that looks for each provider is going to be very different based on their level of training and where they're at and their own individual beliefs. Yeah. Some people have strong beliefs against integrative practices, but they don't have any real understanding of where the movement of integrative medicine is actually at this point in time, at the academic level and at the research level. I see that a lot. People have this very strong, that's all snake oil.
Yeah.
But I don't think that they're immersed in it in a way that really understands where it currently stands.
Yeah, yeah. And as I've noticed, at least in the US, there are a lot more organizations and universities that are coming together to really push this integrative medicine movement. I'm seeing that a lot more in the US than in Europe. I'm in Berlin, and integrative medicine is not even really a term that I've seen around here. But it's good to know that it's slowly making its way into the US and that there's all these different educational programs that are being created for a lot of the medical doctors out there. So it's really inspiring to at least know that is happening.
Yeah, and I have seen more of that sort of, so be careful with this word, but perhaps overly strong or reified criticism of integrative medicine. I have seen it more from some European sources, but I think that's because they're not as embedded in the academic world of integrative medicine here. Yeah.
So true. That's so true. I've noticed that actually as well. So someone asked a few questions. She said, in clinical practice, how do you best explain to a patient struggling to understand the nature of chronic pain because they are so used to thinking pain equals structural damage that their beliefs could be influencing their pain?
Yeah.
That's just one question.
How I would approach that will look very, very different with each person based on my read of where they're at and their understanding of pain. I think the science is a way in. I remind people that, this ouch people think it's a single transmission line, but it's bidirectional, which means that there's transmission line back down the spinal cord to the body. That those downward transmission lines are exceptionally powerful. They're driven by our body's endorphins, our natural endorphins. And so if the cognitive emotional response is one of, oh, crap, shit, this is terrible, I'm not going to be able to ever work again, versus this sucks, this is really painful, and I also know I can get help and that my body's strong and can recover, that they have either facilitatory or inhibitory, call it bottom up, top down sort of pathways. Sometimes just explaining something as basic as that, top down inhibition, that the regions of the brain that are associated with conscious attention, self-referential, self-aware, and cognitive processes are wired such that they can release inhibitory pathways and chemicals downward that inhibit or suppress the ascending sensory information, the nociceptive information. So I don't know if that helps the question, but that's just one of many examples of how I might approach that.
Mm-hmm. And then I guess finally, the last question really is how can all of this be applied in a self-care practice? What are some of the tools and these exercises and things that people can really take home after this event and start to use in their life?
I would invite each person listening to ask themselves, where, if I think of entry points into myself as a living system, spiritual, cognitive, and mental, emotional, physical, and so the physical realm of movement and practices, physical tasks, whatever the level, nutritional, environmental, social, what areas in my life feel out of balance to me? That you answer that question yourself from that type of invitation. I will say I put in a plug all the time for basic mind-body medicine. I use breathing practices, meditation practices, body awareness, guided imagery. I use these skills daily on top of my physical movement practices. They're just embedded into my life. So I do put in a plug. I think that it's good health practice in general to offer dedicated time to practices that we know have potential to help improve the physiological regulatory systems. Because a lot of us are up here, we're on go, do, gas pedal. There's no in between the stop or go, so it's the slow sort of message. So I use a lot of the mind-body practices as a general. I think they're appropriate for everyone as part of good health practice.
Yeah. It all starts with self-awareness. Well, thank you so much. Honestly, this has been incredible. I wish I could keep going in this discussion with you, and I think everyone else can as well. So someone asked if we can get a list of resources discussed in apps. Yes, I will be. So in this, in the email that I'll send out next week, which will also include the replay of this event, I'll also include a list of resources and some of the things that we mentioned. Finally, also, so as I said before, if you guys ever have any questions, feel free to email me at nadia@zayamed.com. And Matt, also, I put your links as well in the profile and in the bio. It's everywhere. So if you guys are interested in that, you can take a look at his profile, I believe, on this platform. If not, it should be in your ticket. And if anything, Matt, how can people contact you?
Yeah, you can use embodyyourmind@gmail.com. And I don't know if it's possible, I know there were quite a few comments and questions. If there's any of them that I can answer, they could be compiled. Yeah. I can write short answers at some point, and I don't know if you do that typically, but I'm happy to answer those. Yeah, I do it. That's perfect. Okay, great. I'll definitely keep track of that because there were a lot of questions and I do want to also make sure those get addressed. Great. All right, then. Thank you so much for everybody who overstayed. I know we went past 5 minutes, but I really appreciate you joining us. And make sure to sign up to the workshop if you're interested in that. And if you are located in Berlin, Zaya, so my company, we will be launching, as I said, an integrative medicine booking platform where you can book sessions and find trustworthy
integrative and mind-body medicine experts located in Berlin. We will be expanding and scaling to Europe as well as the UK. But if you're interested in that, make sure to check out our website and you can join the wait list for that. Other than that, thank you so much, everybody. And I hope you have a wonderful rest of your morning, afternoon, evening, night, wherever you're from. So thank you.
Thank you, everyone. Bye-bye.
Bye.